And then stage 3 is the end of the treatment, and that's where we reinforce the changes that they've made. Again, a lot of compliments and praising, make sure everything is set up in the community or perhaps aftercare. Some children need that, not many. We talk about bumps in the road. So things are better now, but what are you going to do if, you know, Mom, you flip out and you start yelling and calling names? Nobody's perfect. What are you going to do? We want an action plan. What are you going to do if he starts using again? What are you going to do if you, to the young person, if you feel like using? And we have a real solid plan that they can keep in their back pocket, so to speak, because nothing is ever perfect about that. I'm going to end with another video, a father and son. This is several years after MDFT, talking about their experience. Okay, thank you very much. You can get more information. You can email me. You can go to our website that has a lot of information about MDFT, and I also encourage you to use our Facebook page. We have a lot of information about MDFT, but also we're trying to have it be a resource about everything about teens and families and drug use and education and criminal justice and depression and mental health. So I really urge you to use that as well. And now I'm hoping we can take some questions.
Absolutely. We have quite a few. The first one is, can you speak about any efforts to integrate trauma treatment with MDFT and or how MDFT integrates trauma?
Okay, great question. We do, in MDFT, we do have a whole protocol for addressing trauma in the MDFT way, sessions along with the youth, along with the parents, and them together. Now, MDFT is not a treatment for full-blown PTSD. If a youth has diagnosable PTSD and not just trauma symptoms or PTSD symptoms, then we recommend that they go to one of the evidence-based trauma treatments such as trauma-focused CBT, and there are others. And then after, can work with MDFT, maybe a shorter course of MDFT to deal with their family issues. If it's trauma symptoms and not diagnosable MDFT, then MDFT, as I said, has a special trauma protocol, and we can address that and have addressed that and have evidence supporting the effectiveness right there in the MDFT.
Great. Here's one, too. This evidence-based practice sounds very similar to another EBP called Alternative for Families -CBT. If you have knowledge of this other EBP, can you highlight how they are different from MDFT?
I do know about it a little bit. One thing I do know is that although CBT is an evidence-based treatment, this Alternative for Families, I think the evidence is a little iffy, perhaps especially for African-American and Latino families. Don't quote me on that, but I remember reading something. I mean, it's hard to say. It's just what's different is although there's similarities, all good therapies have similarities, of course, but there are also important differences, and it's mostly in the internal of how the therapist talks and relates to the youth and family member. I can't really say more than that.
Okay. Approximately how long has this approach been around, and is there a registry of therapists who use MDFT, and where can they find training?
This approach has been around for about 30 years, I believe. The first study was in the 80s in San Francisco, California. And the place to find, we certify therapists, but all these therapists work inside of certified programs. And so at this point, at some point in the future, we may certify individual therapists and private practitioners, but we don't do that now. And if you go to our website at mdft.org, there's a tab called Locations, and you can get the locations and contact information of all the certified MDFT programs in the United States and in Europe.
Great. And there's one more. This attendee says, we have a Batterers Intervention Program, or BIP, and these individuals have previously been abusive within their family unit. Sometimes the couple chooses to stay together, and an issue that we face as an agency is that nationwide, BIP facilitators agree that couples therapy is not appropriate when abuse is present. When it comes to parenting after being abusive, would you approach this family differently? And how do we utilize this information for adults and their families For example, dad is a wreck because his 30-year-old son is really bad on drugs and neglecting his 4-year-old son.
Well, that's a great question, and it does. So the question is, would we do things differently? Yes and no. So in MDFT, it is very individualized. So we're always going to look at the family who's in front of us, all the people involved in the youth's life or involved with each other, and how we can help them change so it'll be a healthier, safer environment for everybody. That's the guide. And it's really, I like to say, the family comes first. The children, the parents, the family members come first. And the MDFT are the tools that you apply to help this family. So if you have the example that this person said, the couple is still together, or the father is still involved, but in the past he was abusive, well, we're going to deal with that in its way. A dad, the other example, so it's always the family, the circumstances of the family. Of course, safety is first, and you're going to adapt depending on what you need to do to ensure there's safety in the family. But it's the family is first, and then we apply the MDFT to help this family function better, be safe, and put their teen on a safe and healthy developmental trajectory. And you're going to do different things for different families, of course. So it's hard work. So because you have to really, it's not a one-size-fits-all. You have to really get in there and understand the family and the individuals within it to figure out how best to apply it to help this family succeed in life.
And one more came in just now. How do you handle a situation when the trauma for the teen has been so heavy that you cannot rebuild trust for the youth in relation to the parents?
Well, yes, of course, that's a very hard situation. And, maybe trust is an interesting thing, because trust is not going to be rebuilt in this family that you described, in other families, overnight. It's not going to happen in 2 months. It's not going to happen in 6 months even. Trust, it's something we want to talk about in MDFT and we want to work towards and try to build. But the reality is, and we're going to help the family work on this, that's something that's going to take time. When it's been so damaged, it's going to take years to rebuild it. So you may make changes in the youth and the family in your period, but if we're going to have it, a situation, if we expect that the teen is going to completely forgive and trust the parent, that may not happen in the 6 months. That may not ever happen. But that doesn't mean they can't still be a family and help each other. So that's a great, very complex question, but an important issue.
Wonderful. And I just wanted to let you know, a lot of comments have come in saying this should be an all-day or 2-day training in a workshop format. Everyone is very, very complimentary about this and interested in this topic.
Well, that's wonderful. I'm delighted that this has been interesting and helpful. And, at MDFT International, we do provide training. We can come to your site, and we do provide, training for 2.5 or 3 days for programs that maybe can't do MDFT at this point or are considering it. We can come and do it for about 3 days and, teach skills and interventions that you can use in your practice. And I think I mentioned the PACE program in Hillsborough County. I hope one day they do implement MDFT, but they had us up there, and we did a couple days of this kind of MDFT training, and I think people found it really helpful, and they learned things that they could use with their youth and families, even though they can't do MDFT. So if you're interested, get in touch with me, and we can arrange that.
Wonderful. Well, since we've addressed everything that came in and we're getting close to the end, I'd just like to ask all attendees to stay on a couple of moments to hear some important announcements. But first, Dr. Dakof, I'd like to thank you for providing such a thorough presentation on this valuable method of therapy, especially because we are facing the opiate crisis all over the country. Thank you so much for this information.
Absolutely. Thank you for having me. It's been a real honor.